start. Hello, good afternoon, and welcome. All right. Thank you all very much for joining to this session. We're going to be covering about different aspects of AMC Clinical, which are often not talked about freely in a forum like this. So first of all, thank you for coming in, but can I please ask you all to mute yourself? Maybe you all already are muted, but if there's any background noise, that'll help me uh, eliminate any sort of clutter, just to make everybody's experience enjoyable during this session. All right, so without further ado, I'll just do the honors and start up. So we're going to be discussing this session in basically five main aspects, and I've made some points here. There are no PowerPoints, so there are no death by PowerPoint. It's all live and it's all interactive, and you'll have plenty of chance to ask questions. We will have here Dr. Amitav and Dr. Farwa, who are emergency focus clinical tutors. So they will share their own insight, their own journey, and what worked for them, and what they find is little less helpful. So that will give you an opportunity to optimize your own study plan. So as the workshop or this session name is Plan, Prepare, and Pass, this is exactly what we're going to try to do. So let's get, if I can get, Dr. Farwa, are you there?
Hello, everyone. Hello, Dr. Rizwan. Yes, I'm there. Yeah.
Perfect, perfect. And Dr. Amitav, are you there as well?
Yes, yeah, I'm just joined here. Thank you.
All right. Okay. Okay. Excellent. Welcome. Welcome to you both. And thank you all, and especially Dr. Farwa and Dr. Amitav for taking this time in this busy Sunday schedule. I know it's a family day, and I've actually had myself quite a nice walk outside, and I've just come back and I thought, okay, we need to do something. All right. So look, let's talk about AMC. It's a practical exam. It's an exam which requires you to have. I was just making some notes. It's a practical exam which tests your knowledge through 16 role play stations. So the very ethos and very essence of this exam is practice to assess the depth of your knowledge and also your communication skills. It's the marriage of both these components together. If you're not doing one thing, you're going to be having a huge disadvantage when it comes to passing this exam. So we need to realize this very essential factor, that this is the exam which is based on your performance, which is based on the practice. It's not a reading exam, which AMC 1 was. So you need to leave that mindset that this is an exam which I can pass by just reading around, or participating in a course and not engaging myself in. This is an exam which really wants your engagement, and we'll talk more about that. So when they're marking the AMC clinical exam results, they're basically testing your knowledge, your communication, the clarity, obviously, of your communication, plus to make sure that you're a safe doctor. Now, AMC on their website say that this is exam which is pitched at the resident level or intern level, which I think is, yes, completely fine and completely appropriate. Although some of the aspects of exam when it comes to managing the patient would be more at a resident level, like a first and second year resident level. And if you compare yourself to the first and second year resident working here in the system right now, I can assure you that they would be able to, say all these things without any problems. I'm talking about the local graduates where you're getting compared with. For the practical purposes, what I have done is I have decided to divide this session into five main components. We're going to talk about the time as in how much time is really required to prepare yourself for this exam. And we can talk about like further finessing that, the nuances, like if it's your first time or second time, whatever it is. How to make the best out of course, not just our course, but any course that you join, how to make the best out of that course. Um, then we're going to talk and touch base, and I'll share my experiences with multiple OSCE exam. I've done lots of OSCE exam through emergency fellowship, through PLAB, through AMC, and I'll share my experiences. So, what's the better utilization of your time when you're planning your study, personal versus a group study, and then we'll talk about some of the tips surrounding what is the essential factor or essential recipe on the day prior to the exam. So the night before the exam, how can you control your nerves, calm your nerves? This is especially very relevant for the participant who are going to be, taking their exam very soon. And then we'll open the pot for the Q&A. So if you've got any questions, any insights, any tips to share, please jump in and help your colleagues out. All right. So first, let's get Dr. Farwa and Dr. Amitabh to introduce themselves. So Dr. Farwa, if you don't mind, I'll start with you, ladies first. Would you like to please introduce yourself and tell us something about you?
Thank you so much, Dr. Qureshi. Well, my name is Dr. Farwa, and I have recently passed my AMC clinical exam. The whole journey was super difficult for me, and I'm sure there would be a lot of mothers out there who are having toddlers and who are studying with, their whole family, with all of the responsibilities that they're having. But trust me, what I want to say is, like, if you have a specific pattern of studying, like if you have a specific routine and you just stick to that specific routine for a while, like it's like for me, it took like 6 months to crack this exam in a single go. But it's like if you stick to that specific routine and you are, going with all of the structures that you have learned through a course, you will be fine. Like it's a completely doable exam. Some people say, most of the people say that it's like there's a very low passing rate when it comes to AMC clinical. It is, but it's still a doable exam. So yeah.
All right, that's very good. Thank you, Dr. Farwa, for sharing your insight on your personal introduction. And when did you do your exam, if I can ask you that? When?
I did my exam in November.
All right, so very fresh,
Yeah.
and I think I'll touch base with you on some of the key questions regarding the exam and its format, and through your experience of teaching on our recent courses,
Sure.
which is going to help lots of candidates. Dr. Amitabh, sir, if you'd like to please jump in.
Yeah,
and
thank you. Thanks for the opportunity. I actually passed AMC Clinical last year, and now I have started working full time in the hospital emergency. And I would say like a couple of important aspects for your study and preparation. First one is the self-study. You have to study by yourself. So there is no other alternative of self-study. For example, if some cases are coming nowadays, cardiotocography explanation. Okay, so if you study that one, it will take 40 minutes by yourself. But if you read someone else feedback or listen to someone else, so it will take 4 hours. And when you are studying, always study in a cluster wise. So all the cough, all the vomiting, the class here in the emergency focus, that will be again cluster wise. So I would recommend you also study yourself in the cluster wise. And the next important one is you have to go back to the textbooks and guidelines again. So the same book you have studied for the part one. So these are the same book, John Murtak and the Royal Children's Hospital guidelines. And we got some also the study materials here and some videos here that will also help. So there is no shortcut of like other than studying the like the academic materials and the books actually, okay, and the role play. So you have to spend lots of time on role play. So what you study, you again practice with your study partner.
All right.
That's it. That's the tips. Thank you.
Okay. Oh, I'll dissect more tips out of you. Don't you worry about that.
Yeah, thank you.
I've got an hour to do that. Now, I have also got Dr. Maliha Zafar here. She is actually very generously come in to pitch in. Dr. Maliha, would you like to please introduce yourself, and we'll take it on board?
Yeah. So is it okay if I turn my video off, or I can just continue?
you can on have your video on. In fact, that will help my cause because people will
Okay.
get bored just looking at me, really.
Exactly. Okay, so
Yeah.
it's okay. That's why I asked. Thank you for that. Okay, so I am Aliha Zafar, and I just cleared my exam in March. I got a face-to-face date first, but then because of my personal issues, I went back to my country. I have to go there. My father was sick, and they gave me an online date because that was available at that time. So I went for this exam, and I cleared it in the first attempt. First thing which I want to tell you guys, it is completely doable. It's not that it's not doable. I was in the hospital for at least 2 months with my sick father, and he passed away just a week before my exam.
I'm sorry to hear
And
that.
yeah, so even then I was able to clear the exam. Just I'm telling you this, that doesn't matter whatever the situation is. If you have a good approach, focus on the study, and you're consistent, you can easily do it. It's completely doable. Just don't care about the passing rates and all these things. Doesn't matter at all. First thing which I would like to tell you is be consistent. Please be consistent. Even if you're doing 2 cases, 3 cases, 4 cases, do it every day. Number one. Then number two, choose a good study partner, a good one, in a way like you both can share or contribute to their things. Like it's not like just one way traffic. It should be two-way. So like if you are discussing something, there's something for the partner as well to input as well. Second thing is the third thing is that please try to do random questions. Don't pre-plan your things like, okay, so of course you have to study the Marwan notes or whatever notes are there. But when you are practicing with the role player, try to ask your role player study partner to bring in some a random case which you don't know about, and then based on that presenting complaint, make your DDs in your mind and then discuss the case. If you know the case before that, of course you know the system, that what system you're doing gastro or cardio or whatever. But it will be more fruitful if you do random cases, like they are not, you don't know the case, you just focus on the presenting complaint. It will be more focused in that way. It will be easy for you to make the DDs in that way. Yeah,
Right.
so these three things which I think is very important.
Thank you, Dr. Maliha, and I'll take you up on each one of them one by one.
Okay.
Now, first thing which I'd like to talk about, and the reason for this particular session is that I get numerous messages, emails, and sometimes even call about how to, plan your timing, your efficiency, your study, your books, and all that. And despite, I think, me going through these things every time we're about to start our clinical course, there seems to be a constant appetite and hunger. People would like to be more in the know about how to go about this exam. So let's talk about the time first. And I often say it's not about the amount and the duration of time. It's more about the efficiency of time, how efficient you are. Like, as Dr. Far was saying, that look, there could be many participants here who are attending the session today who are actually about to take the exam, who have families, who've got job priorities and any other priority. In my experience, anything between 4 months to about 6 months max would be fine if you've got very pressing commitments, young, family members, or children to look after. And but it is even doable in 4 months, minimum 4 months time as well. The longer you stretch it, the more dilute your study becomes. You get more confused. It becomes more convoluted. You begin to question your own approach when you meet more people, when you talk to more people, when you attend free live sessions like that. It will just complicate the entire approach that you're having to the situation. The less time you have, I mean, less than 4 months, it's going to sound like that you're underprepared. You're not basically exposing yourself to the maximum combination of different scenarios. And remember, it is a practice test. It is a test which requires you to speak, which requires you to articulate the breadth of your knowledge and sometimes even depth of your knowledge in certain particular scenarios, along with a communication which is clear, concise, and in time. So it requires a fair amount of practice to have that harmony between your knowledge, your depth of knowledge, and that speaking clearly, because we're all migrants, we've all graduated from different countries. And I've seen people who have got excellent English, excellent mannerism, but they lack knowledge. They have not participated enough in time, and they are not able to pass exams. So some people are under the impression that if they've got good English speaking and they're very confident from that point of view they're going to pass the exam. It doesn't unfortunately work like that. You need to have a very clear, very comprehensive review of that station. Now I'll take on Dr. Farwa's opinion on time, because you shared a little light that you spent about 6 months. And I would like to get you, Dr. Farwa, to tell us that how can people make their time consumption more efficient, in your experience? Because you said that you had young family, you had
Yeah.
other priorities. What do you find more efficient way of utilizing the time?
Okay. So thank you, sir, for giving me a chance to speak about it. So basically, those 6 months were like I was pretending as I am not on this planet. I am on some other planet. I'm on a war.
Oh,
And literally, my family members were the one who were affected the most. But it's okay because it's temporary. And the success you would get, it is like, it's really worth it afterwards. So what I would say, those 6 months should be very much planned. If you're taking a course, then that course should be, you should be able to make most out of that course. Now, how you can make the most out of that course? I used to attend one course and it used to be like for 4 to 5 hours in the morning. And when I used to get finished with that course in the evening, I had a study partner from the similar course, and I used to practice at least 10 role plays a day with her. So those 12 weeks of that whole course, and then afterwards till my exam, I had I guess 2.5 months or 3 months. And that was a rush period. We used to kind of, first of all, we were like, okay, we have done all of the topics, but still we need to kind of, highlight most of them when it comes to, our list of differentials and everything, because it is really important when you make a list of differentials. It's not, you should not have a tunnel vision. You should be very broad. Like if it is a young female who's coming to you, you should be considering all the gynecological causes as well. You will be considering surgical causes as well. You will be considering medical causes as well. All of those things. So you should be very mindful of that to work on your list of differentials, because your list of differentials is one which would kind of, make you ask all of those questions, and
yeah,
will help you in
we were
that
talking about,
space.
it's about the knowledge, broadness
Yes,
of knowledge, the depth of knowledge, and obviously being a safe doctor. And differentials
yes,
are where the safety is. And we'll
yeah,
talk about a bit more in detail. Now, in terms of, you said that you did a course and then you complemented the course with some private study time
yeah.
with a partner at the end. So how much time were you donating out of your family commitments every day?
Weekdays, we used to have weekends off. We had a rule that we are not studying on weekends at all.
Oh, thank God
And
for that.
yeah,
Otherwise,
but in the last 1 month, we were studying on weekends as well. Not that much. We used to do 5 cases on weekends and 10 cases, like 10 cases each on weekdays. So that's how you were studying. My only child literally disowned me in those days. He was like, he was not even,
yep.
I guess someone's mic is unmute.
Yeah. Well, can I just please ask anybody who's just recently entered, please mute your mic, just to not create any audio interference. And if you will do a Q&A session at the end, and you can open your mics then. All right. So yes,
Yeah.
so weekends were off, weekdays were full, but on the
Yeah.
weekdays, you are saying that on an average about 4 to 6 hours, you reckon?
4 to 5 hours with my study partner and 5 hours for the course.
Wow, that is daily grind.
Yeah, on a daily basis.
Oh,
Apart
that's
from
amazing.
weekends.
That is amazing. All right. Now, tell me, and I think this is something which I would probably touch base in detail as well. Tell me, Dr. Amitav, what is your suggestion on those? What would your strategy be? You've recently finished one-on-one course with us. You've taught with us
Yeah.
in a couple of courses, and we do a lot of role plays, which I think is really the way forward with this exam, because it really infuses the practice, and the knowledge can be built up by the candidates in their own time, as Dr. Farwa was saying. What
Right.
would
Yeah.
your tips be in that regard?
Yeah. So as you said, like 4 months or 6 months would be enough. for the preparation. Make sure you utilize your time properly. So it's very important you study on regular basis. And if you miss 1 or 2 days for some unseen, unforeseen problems or family commitments, that's all good. But make sure you are studying on regular basis. And when you are studying, as everyone is saying, like follow a pattern, okay, not here and there. And another tips that's really important, I would say, like that doing the random role plays. What I did actually, I kept the morning time for my self study. So I used to go to the library at that time, and evening time I used to do some role plays with a group of doctors and sometimes other study partners. That's what I have done.
So it seems to me like the practice is really the key. Dr. Farwa and Dr. Amitabh,
Yeah.
you
Yes. Yeah.
have been very practice oriented throughout your study time. You didn't really waste
Yeah.
much time into, you had your own time in terms of creating the meat around the bones, like with the
Yeah.
theoretical study, with your own books on
Yes. Yeah.
AMC1, as you were saying. And then you just put yourself out there in terms of keep on opening up your, there's a language efficiency which both you and Dr.
Yeah.
Farwa have perfectly, and then there's clinical acumen and efficiency which comes in your communication in that set time, which I think practice is the real key. And
Right.
we
Yeah.
often talk about that, Dr. Amitabh and Dr. Farwa would probably agree as well, that when we're doing some of the sessions, the candidates are completely in the background. They've got the cameras off, and it really takes a lot of encouragement for them to come out. And I can understand, look, you may have a background which is cluttered full, and that's not an issue, and you may have some background noises, or you might feel that you're not ready. That is the other thing, that you're just testing grounds, and you may feel that, oh look, I don't want to make an fool of out of me. What would you suggest for that, Dr. Farwa, the candidates who are really reluctant and they're afraid that, look, they haven't got enough practices yet, and if they do do the scenario with the faculty and get a critical feedback, it may just destroy their pitch and demoralize them, so as to say. What do you suggest on that?
What I used to think on that, like, I was one of the most hesitant participants among all of my course mates. It took me a lot of time to kind of turn on my video and talk about something. I was like, I used to think that I am pretty much deficient on knowledge and everything as compared to my other course mates. So that was really hard for me initially. But one of my tutors, she advised me that, okay, you have to just close your eyes and jump into that. The first time would be the hardest one, but once you'll get used to it, trust me, you'll be fine. And if you can't do it right now, you will be in a big trouble in your exam. So just don't do that. You have to kind of make yourself immune to all of this. Otherwise, in the main exam, you have to that would be a very new thing if you will be out there in front of everyone, role playing for the very first time, face to face or online. Even online, you have to kind of turn on your video and
That's
you
right.
have to communicate with them. So that would be very hard for you.
Yeah.
And about any critical sort of feedbacks, what I would say is, like, trust me, just take it in a positive way, because whatever is happening here would be pretty much essential for you when you'll sit in your main exam. You will remember all of those feedback points in your main exam.
Now that's very
So,
important point, actually, critical feedback. And
yes.
I'll take Dr. Amitav and then talk to Dr. Maliha as well on that. Now, this is very important. And I think I pride myself that our course is designed in a way that we are not here to, uh, I'll use the word ego massage. That I'm not there to make you feel comfortable when you're in preparation mode. I want you to feel uncomfortable, out of your comfort zone, so that you learn these things and you're able to impart that. Now, Dr. Maliha, people often feel that the critical feedback can be discouraging. Um, in our course, we have really got a very structured framework, and I put in the critical errors there. That, look, we are judging every participant who's role playing in terms of their communication, in terms of their facial expression and knowledge as well. And And that's so very important, because if they are getting into that rhythm and doing things, what do you think about that critical feedback? Do you find that critical feedback can be harmful, or it can be beneficial? Obviously, I'd like to learn from as much people, as many people as I can. What do you
Yeah.
suggest in that?
Yeah. So I will just it's 100%, 100, 110% beneficial. And I will say in a way that what whoever is giving you critical feedback is the one who's the most sincere to you and who really wants you to pass. Even if it is for the tutors, even it is for a study partner. If the study partner is just passing the time and saying yes, 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 you're right, it means that the study partner is not very sincere to you, and you might consider changing the partner and the tutor as well. So just please think it like that. Don't take it like it's not nothing. If you will do the mistakes here, and you will, and somebody's there to give you the critical errors, it's a blessing. Take it as a blessing that somebody's giving you the critical errors, and take it like as a take home lesson, and then work on them so that you don't do them in the exam, which is the most important thing. Nobody is going to tell you in the exam. Even when we are practicing and practicing, and then after the case, when we did it in an exam, I wanted some feedback from the like right there in the exam
It
as well.
wasn't there. It
Because
wasn't there.
it wasn't there. We have to wait for 3 weeks for that, but still, yeah. So just like sir said, that it's very beneficial, and please don't take it like and don't take like if you are doing mistakes in one case or in one class, I'm not going to do it again. Don't please don't take it. Just think like that. That okay, I have done these mistakes. I'm not going to do it again, and I have to try myself again. In any other case, in any other class. So yeah, take it as a challenge, and then correct all these mistakes. That's more important.
Now, Dr. Amitav, you've done quite a few sessions with us since last year. What
Yeah.
do you think that the candidates generally who come to the course, and you give them the feedback, what is their take on the feedback, especially the critical feedback? Because obviously everybody's okay when you give them a good feedback, positive encouragement words, and lots of the courses are, I think, in that zone that they make you feel good. And they might not even role play. They'll just go through a theory cluster for like 2 hours or 3 hours, which you could have actually utilized your own time, as you were saying, through your own books and in your own time. And what you should be doing in a course is actually exposing yourself to the role play. We'll come to that a little bit later, but what do you think is the participant, when you give them a feedback, what is their take on it?
Most of the time they accept it very happily. And when, especially after the mock exam, I give them the written feedback. So my feedback is when I say it politely because everyone is doctor. But whenever I say, especially on the in writing after the mock test, and in that time I point out like this was your mistake, and for this one you failed this station. I can give a quick example like. If one candidate, it was a abruptio placenta probably. So you have to check the uterine tenderness in physical examination, and you have to check the fetal heart rate also, or fetal heart sound at least. So she missed or he missed both of that. So I write down because of this failed the station. So that's what, yeah. So it's really critical. Like you learn from the mistake, and that's why we're very strict. I think everyone is strict on feedbacks.
I think
Yeah.
so.
Yeah,
Now,
yes, yeah.
let's take this discussion a bit further. We move on to the courses. Now, um, we've touched most of the points with the time and efficiency. I think there's a significant overlap, and this will keep on happening because so many traits of the course and the preparation are so intermingled. It's very difficult to classify and subclassify into distinctive headings. But some of the things that I'd like to ask Dr. Malhia first, like how to get the best out of your clinical course. And, I think the courses are all about, refinement and expansion of your knowledge. In fact, firstly, an expansion of your knowledge, because you're not only performing yourself, you're also seeing others perform. And that is your expansion. You're taking new habits on board, new traits on board, and then you're refining your own practice and your own words and commentary based on others, which is the way to learn about it. And obviously that the whole aspect of clinical communication where the tutors are so very important when they're telling you that, look, your terminology, your wording, your timing needs to be appropriate this time. My question to you, Dr. Maliha, is what is your advice to make the best out of the course? Like we do 8-week course and our next session starting July the 4th, and there's already quite a few people who are registered for it, but I just want them to have an understanding that, look, they've paid for a course, they're
Yeah.
investing more in time, more
Mm.
than money. What would be your advice to make the best out of course? How can they do that?
Yeah. Okay. So thank you for giving me that question. It's very important. And that is that whatever the course is, whatever the course you're taking. Unfortunately, I didn't take Dr. Rizwan's course because of like I used to do my own self study, so that's why. But most important thing is that you have to have your own study before the course. If doctor, I don't know the
That's so
pattern of your.
important. Please, can you
Yeah.
please highlight? In fact, I'll just stop you there, and I'll
Yeah.
just because you've just highlighted something which I think you said your own
Yeah.
study. Say, for
Yeah.
instance, if you're about to do a cardiology cluster or session today about cardiology cases, hypertension cases, and we normally give them out a list of topics that we're going to go through. What do you mean in terms of your own study? How would you encourage them, and where do they need to study from?
Yeah. Okay. So it's very subjective. Like where do they want to study from? Because I will trust me. The theory part is over with the part one. Honestly, it's more like we're picking the diagnosis and then explaining it to the patient. That is the most important thing I think in my part two, because most of the tasks are diagnosis and DDs and explain the diagnosis to the patient in layman terms. That is the most important thing. So if you're done the AMC one, you might have gone, of course, with all the theories. So by that I mean that you can go through any notes you are comfortable with. I don't want to name them right now because it's like I don't, because it's everyone's comfort, like whatever.
I
And if you
agree.
have any, yeah. So it can be any one of the notes, but studying thoroughly the whole topic. By the whole topic I mean is the what can be the differentials in your mind which can come, like in the cardiology cluster, chest pain, take as a chest pain. Okay, so what do you think can be there with the chest pain? If it is an acute one or a chronic one, then you can divide that, and then depending on that you can make your differentials. Okay, that then you have to study each of that case. What will be the presenting complaint of that case? What will be the examination findings characteristic to that case? And then what will be the management specifically of that case? So pre-reading means this thing. There is no point of doing any course if you are not doing any pre-reading. You will just go there, sit there, take a 3-hour class, waste your time, waste your money, and you'll come back and you won't gain anything. Trust me. If you have a baseline knowledge in your mind, you will grab maximum from any course, because then you know, okay, this I know and this I don't know and this I need to work on. But if you're totally blank like a whiteboard, you don't know anything, like, okay, where should I start with, or where should I put more focus on, or anything like that. This way. And guidelines, I will say, whatever you can get hold of, any guidelines are very important. Instead of reading the whole books, always go for guidelines. The Australian guidelines, they're there for almost every topic. So because they clear the confusion there and then, very to the point, and mostly the RACGP or the KEMH, or we already know all of them, like we've been through them in part one as well. So read the guidelines if you have any confusion, and then management, and then of course the tutor will be there to guide you further. But don't like very much mingle in the theory. That's not very important. But of course history and what differentials comes into your mind, that's more important. And pre-reading, of course, very important.
Thank you. Now, I'll just quickly ask Dr. Farwa a question which get asked to me quite frequently is before, whenever our course are about to launch, I get barrage of emails and text messages and, WhatsApp messages that, do you provide videos with the course? And I just wanted to get your comments on that, because we do,
Yeah.
obviously, because there's been a huge demand, and I feel there's a role for it,
Yeah.
without going into the further details. And that role is that, look, if you're participating in a session, you've actively participated, obviously you cannot take notes at that point. There might be certain valuable points which have been given to you by your faculty, or somebody else has made a very valuable point, and you'd like to, go and revisit the situation in terms of seeing your own self being performed in front of the
Yeah.
camera.
Yeah.
That's your body language, that's your communication skills, that's your knowledge, how it's flowing in terms of time frame. And I think that's where the video has a role.
Yeah.
What do you think about the participant who just solely rely on videos and, they're not, I don't know, like, I mean, I feel that, this is a disservice to your own self. If you're just slowly relying on videos that, look, I've got to work this, and that can be understandable if you've got to work and you've got a commitment once or twice. But what would your take on that be, Dr. Farwa?
Well, Dr. Rizwan, I'm really sorry to say, but it's completely procrastination. Like, I don't believe on kind of, watching videos afterwards if you haven't attended a live session, because live sessions are pretty much interactive. The tutor is judging you on your knowledge, that what is the level of your knowledge and how much there is room of improvement. Right. And that is the point where you also realize that how much I have to study and what are the aspects that I should cover. Now, if you're just watching a video and you must be kind of, doing something else as well, doing house chores and everything, it may be beneficial if you have attended that live lecture previously, but not, if you haven't attended that lecture and you're just relying solely on, those recorded videos, I don't think so that they would be that much of beneficial. But if you are attending, live sessions, you are being interactive to the teacher, you are role playing with the tutor, that is something that we used to cry for, that, okay, that's my turn, it's my turn, it's my turn. I need to have that slot for myself. But it's like, if you're not role playing for this exam, the videos are not beneficial, unfortunately.
Yeah, I often say, I was talking to Dr. Sandia, who has worked with us for a long time, and she was saying that, Rizwan, unfortunately, the participants' mindset is being spoon-fed, and they want the videos, they want the notes, but when it comes to their part of the bargain, they're not really pitching in, and they don't see that they're actually wasting their time and money, and plus they're going to fail that exam, so they're wasting their time, money, and efforts. And obviously, as you said, that your family was the real sufferer in that preparation. I can relate to that. The other thing I often, I give an analogy for, like, when you go to the live concert, right? If you go to Junoon concert, I used to like Junoon when I was in the college days. It's really exhilarating. You engage, you dance, and you engage, you memorize, and it stays with you. That experience stays with you, right? As opposed to listening Junoon or listening any concert or song on CD or any record. So that was my way of saying that, look, if you're participating live, it's just like a good experience. You feel it's also, I think, inherently linked to your mental well-being as well. Because when you come, and you interact, you feel positive that, look, I've done something today. I've taken an effort of coming up. I've taken an effort turning my camera on, and I've interacted, done a couple of cases, and I feel good about it.
Yeah.
As opposed to
that's true.
Dr. Amitabh, what do you say? You've got some valuable, and you seems to have very important points to make on that. What would you suggest on that?
Oh, thank you. So in the course, probably they will have the access to all of the pre-readings. So you'll get the pre-readings and the recording of the previous classes also. And again, this is not the substitute of attending the live class. So you get your chance to do role play, and you can interact with other doctors or other candidates in the class. But those who are really busy, for example, some are working full time, some are GPs. So for them, you can rely on those recorded videos. But I would say try to be interactive and try to attend the classes regularly, all the classes. And in any class is usually like 3.5 hours, sometimes 4 hours. So you won't have again like to spend another 4 hours. So I think it will take eight hours from your life. Yeah. 24 hours. So it's better to attend the class in a go, 4 hours. That's done. That's it.
That is such a valuable point that you actually, by not attending the class and watching the video, you've actually duplicated your own work.
That's true.
You're just going to waste the time. Now, let's move on to the next session, which is very close to my heart. And I'll actually share some of the personal insight, is personal versus a group study. And Dr. Amitav, I'll take you on that one, because you made some previous references about, personal study and a group study, and you had some
Yeah.
time and figures. I'll tell you, when I was doing my ED fellowship exam, it has got 20 OSCE stations over 2 days. It's quite rigorous from that point of view. It's a depth of knowledge, it's a performance at a consultant level, so it is testing you at a level of a
Yeah.
consultant working in Australia. And I took 2 courses, and both of those courses were like 2-day courses. One I took a very beginning. I actually went to New Zealand to do that course at the very beginning, even before starting my study. And I was under the mindset that, look, I want to know how to study and what's the resources to go through, and it was from that point of view. And then I did another course which was about a couple of months before my actual exam. And in between that time, I think when you're working on a floor in a hospital,
Yeah.
I took the points from both those courses and actually implemented it at my work. So I would do every scenario in 10 minutes or 8 minutes, whether it be
Mhm.
communication, whether it's interpretation of ECG and teaching the student, or whether it's, describing an X-ray, or whether it's, breaking a bad news. I thought subconsciously that I'm in exam at my work. And my consultants were telling me that this is a very good way, because you have actually got a role player in front of you who's like a real person, who's in real pain, who's got a real medical problem. So
Yeah.
impart that knowledge that you've gained through the course through that, and it'll save you so much time in terms of your personal study, the question that they ask, because exams are, after all, based on these real scenarios. So that was
Right.
something which helped me. Obviously, most of the IMGs are not working who are taking AMC Clinical too, but that's where I think the group study and interaction comes in handy. So I guess my question was, can you please share your advice, or tell us, or tell the participants rather, what would your advice be in terms of personal versus a group study, and how should someone choose their partner and go about it?
Okay, so it's a very tricky one and difficult one, and it depends on your luck. Actually, you get the right study partner. Most of the time, you have to find someone who booked the exam, with the same time. For example, you booked the exam in August, and someone you have to pick up who also booked the exam on the same time. Like it could be September, but it's not on the next year. So booking the exam, that is the main drive for a study and role playing. So you pick up that one. And as Dr. Maliha said, choose this right study partner. Study partner is saying yes, 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 not going to give you the right feedback and not listening to you carefully, and not motivating you for the study. So you can skip that one. And sometimes, again, if you are busy and you find someone busy, that's a good combination. And if you can spend time in the morning and you pick someone again in the morning, so that's how it works. And someone
Yep.
is working 9 to 5, so you want to study 8 to 10, so that's good. So you pick up that one and make sure that your study partner also studies, and so you both study together and you role play together. That is the
Yep.
that is the good combination. Yeah,
That's right. That's right. So
that's
that's
right.
that's
Yeah,
actually very important, because
yeah,
I remember that we were doing Skype sessions, because some
right. Yeah,
of my friends were in different state, and I would
yeah.
do Skype sessions with them. And I think one of the things which helped me is that I was very regimented at that time. I said, look, we're not here to socialize. We've got 1 hour or 2 hours at max. We're
Mhm.
going to do these scenarios, and we put the timer on in terms of feedback, 10 minutes of feedback, 10 minutes of performance, and moving on. Now, Dr. Farwa did a lot of feedback session, like a buddy up sessions. What did you find? Like, do you think it's okay to have a casual approach or socialize a little bit, and then, or do you, looks like you were very regimented as I was. What do you think is the perfect medium to have a well-being and as well as, benefit you from the exam point of view?
Well, so to be very honest, what happened was initially I had face-to-face sessions as well with one of my study partners, but then I thought that it's just causing a lot of exertion for me.
Hmm.
I used to come home and sleep straight away for
Hmm.
good 3 hours, and it was like literally cutting down on my energy. So what I did was like, then I switched to my Zoom sessions. Those Zoom sessions were saving me time of, traveling and, uh, walking
Parking.
and those things. Yeah,
Yeah, okay.
parking, walking,
Yeah,
everything.
yeah.
So that's how I did. And it was very beneficial for me as well. The other thing is like, regarding study partner, I would like to say, your study partner should have the same exam date that you are having and the same kind of motivation,
Yep.
because sometimes you're sharing the same exam date but your motivation, it differs, it varies from person to person, right? So just make sure that your study partner is equally motivated. And as Dr. Maliha and Dr. Amitav said, that uh, the person who's giving you a critical feedback, he's the most precious person in your life, and his feedback would be very beneficial at the end of the story. So yeah.
Oh, that's very good. Thank you. Moving on. So group study, you definitely recommend group study. It saves you time as long as you're both equally invested with dates, with passion, with the same amount of zeal. It is unreplaceable.
Yeah.
Obviously, the personal study, you're not really aware of how you're going to make progress or what's the feedback is going to be like. Now, moving on, I'll touch base with the time. Uh, you know uh, the day prior to exam, and that's, I think, we put ourselves into a frenzy. So you've got an exam tomorrow, and you've got a whole lot of build up to the exam. Obviously, you've invested 6 months, 7 months, maybe you're doing it for the second time or third time or whatever it is, and you just make a nervous wreck out of you, which just completely destroys your preparation and pitch. Share us a few tips, and I would ask each one of you, starting with Dr. Farwa and then Dr. Maliha and Dr. Mitaf, that what would you advise the candidates in terms of the day prior to exam, like how to. My suggestion would be to going through the frameworks, like not exactly practicing each and every topic obviously on the last day. That'll just completely make a nervous wreck and make it like a complicated algebra in your mind. So I think going through the frameworks, the introductions, the body language, the conclusions, and the ending approach, so you know that you're not going to mess it up. These frameworks are there to protect you. um, Key knowledge and facts, like some of the things which you must know in terms of time frames of doing a certain test, and in terms of linking up different services, the guidelines, specifics which you need to know. And tell us about your rest, like how much rest should we have, and how much dinner should we have, and then um, what is the dress code like. So I'll start with Dr. Farwa, and we'll move on to Dr. Maliha and Dr. Mitaf. Please share us your tips just a day prior to exam.
Okay, so my story was quite a bit hilarious. One day before my exam, I literally sent my husband and my son out of the house to a rest house. That okay,
No,
I can't.
can I stop you there, Dr. Farwa? I think
Yeah,
you have just set such an important clue
yeah,
here. I would encourage actually everyone to book a hotel closer to the exam venue.
yeah.
And I
It's
have
very
seen
important.
one of the friends recently. In fact, one of the friends told me that their wife had a GP exam,
Yeah,
and she asked the husband and the kids to move away from the
yeah,
house because she was having an exam. And I said, "Where are you today?" He said, "I'm in a public library with the kids because my wife is having an online exam." So I think
yeah,
that's very natural because there's so much investment right now. So
yeah.
please go ahead. Yes. So I think yes, having a
Yes,
set venue to yourself, like if you're doing an online version, or if you're away doing a in-person exam, then booking a hotel room would be,
yeah,
yep. All right. Okay.
yeah.
Then
So one day before, I literally dropped off my son and my husband to a rest house, and the rest house guy was literally asking that, "What happened to you guys? Don't you live in the same city?" And my husband was like, "My wife kicked me out of the house," and I was like, "Okay, it was important." First tip is like you should do everything to make the environment sound and suitable for your exam. You should be relaxed, like even if your children are around you in on the main exam day, and even if you have a separate room, you can't do it because there would be a lot of things going on your mind. So
hmm.
just try to run away from all of the distractions. Number one. Number two, make sure that you are preparing your lunch one day before your exam, and the lunch shouldn't be that much heavy. I completely relied on strawberries and fruits fruits and salads, those things, so that I just can't, doze off in the middle of the exam.
Yeah.
The other thing is like I had a complete 8 to 9 hours sleep one day before my exam, because I know I can't even talk like normally when I'm, sleep deprived. So sleep is very important, and don't rush into things one day before. Whatever you were supposed to do, you have completed your study. Now it's time to just have a look on recalls, if you are getting any recent recalls. Like I had before my exam, there was one more exam, and I just went through all the topics very superficially, that okay, if this comes, that then my structure would be this and my list of differentials would be this. I literally didn't study at all. And one thing more, one day before your exam, this software takes a lot of time to kind of to get installed and everything. So just make sure that you're doing it one day before your exam. Everything is ready one
Like your
day before
computer
your
is
exam.
booted up, it's not got any
Yes.
updates listed, and your power supply, everything's connected. Now,
Yeah.
moving on, Dr. Amitabh, did you do an online exam or in-person exam?
Yeah, it was online. Yeah.
All right. So in terms of dress code, what do you suggest for an online exam? How, and I think that's probably relevant for both in person as well as online, because COVID restriction last time there was online, there's more in-person dates available. What the dress code of the candidates should be? Because somebody told me, the candidates would turn up in their slippers very casually. They would just have a complete disconnect that this is an exam. You need to have a certain level of courtesy with your mannerism, and dressing is a part of communication. Really, the way you dress, the way you comb your hair, the way you present yourself, the smile, this is all a part of the exam. Whether you like it or not, you are getting assessed, and the examiner are going to get turned off, like, oh, look, this candidate's not even taking the effort of presenting themselves well. So tell us something about what should be the dress code, and how should you present, especially for an in-person exam these days when the candidates are taking.
For face-to-face exam?
Yeah.
Face-to-face exam. So what I have never seen someone is going with the denim or the jeans. So you should not go with that one.
I agree.
Then it's again, sometimes stress makes you really feel really hot and anxious. So denim is a hot type of like pant. So you can do that one. Just a normal pant, like the black pant or navy blue, just a something like sober and polite, that one.
So like a smart casual, a smart business
smart
casual.
Casuals, smart business casual, and the shirt like the light color shirt. So should not be the t-shirts or polo or something like that. And it should not be the shoot again. So you're not going to get the complete shoot and something. Someone wears the tie. It's also fine. Yeah. So if you're comfortable, you don't feel sweaty and not hot. So that's also good. So shirt and just the normal pant and the shoe, that's all good. Yeah. So just that what you have done in your country, that is the dress up.
Yeah. So because I think having a jacket, when I had the emergency fellowship exam, I wore a jacket. I did not, I think, remember wearing a tie, because we had to, in resuscitation station, we had to do a CPR and things like that. So, but I think now the trend is that they're allowed to wear scrubs in emergency exam, but that's for emergency exam. My suggestion to all the candidates who are doing in-person AMC clinical exam would be smart casual, as you said. A
smart
shirt,
casual and the comfortable shoe also.
Comfortable shoe, like smart casual means a collared shirt, which is of light color, which is not offensive color, bright color, with a comfortable, stretchy trousers, be it a man or and plus a jacket if you find like a light jacket or a sweater or something like that, just to
or a cardigan. That's also good. Again, it should be something like the not too colorful, looks nice. Looks like a doctor.
And about Dr. Malika, what do you suggest for the women? Like how should ladies dress up for the exam? So that's for the men, and how should ladies dress up?
Yes. So the first thing is that please don't wear very brand new clothes, like the clothes which you have just bought yesterday for the exam, because you won't be comfortable in that. Breathable clothes.
That is a very good point, actually.
Important.
Especially the shoes, brand new. I bought my new shoes for the exam. All right. Okay.
I have to wear them. Yeah. So don't do that, because that will just add on. And because trust me, if you're not comfortable in your clothes, you cannot present yourself properly. You are not confident enough. Whether if it is a face to face or not, it's, I think, more important online one, because you have to sit for such a long time. So
Mm.
you have to be like very extra patient, and your clothes should be very relaxed, not like casual but relaxed. And it depends upon upon the wear which everyone likes. But for the it's just it can be a formal shirt, just like Dr. Zwan said, that it a simple formal shirt, not very bright colored, not very like sober colors, light colors. And for the, you can wear the pants, or you can wear the more important is the pants. And if you're going for an Eastern wear, then you can the simple, I think, a short shirt with a proper trouser, that will be good, or whatever you're comfortable with. And I will say, don't avoid very long scarves or something like that.
Mm.
Wear a short scarf wrapped around your neck if you're or if you're wearing a hijab, then it's even more comfortable and convenient, because then it's around your head, so it won't be bothering you all along the
Yep.
way. Yeah, so but avoid wearing long scarves and all those things, because then it's very hard for you to manage
Yeah.
that along with the
And look,
exam.
I think examiners also make a draw parallels that, look, this is a doctor who is going to be starting work after passing this exam. And their
Exactly.
clothing and their mannerism should reflect that of a doctors who are actually working in Australia. So if you're putting yourself out there as that you're very restricted and very, covered, and you've got like a complete scarf and,
Yeah.
then it just sends out the different ideas. So yes, you're right, it needs to be comfortable clothing, it needs to be representative, complementing your modesty and your beliefs, at the same time making a connection that you are going to work as a doctor in a different country. It's not Pakistan, India, or Bangladesh. So you need to make a correct level of adjustment without letting go of your own personal beliefs. So I think that there's a fine balance there.
Mm.
Now let's talk about the day of the exam. Dr. Farwa, tell us about your day of exam. Early wake up, professional attire, everything's there. You've had your
Yeah.
cup of coffee, you've got your strawberries there.
Yeah.
And tell us through, I'll share, I think, and I'll always advise that I was thinking about that during my walk today, that it's a 16 station exam. And one of
Yeah.
the key tips that I would like to give every candidate: take 16 station as 16 exam.
Yeah.
If one station is messed up, forget about it. It's not going
Yes.
to make a difference. It might not even be counted for that matter.
Yeah.
The next station is a completely brand new exam. So if
Yeah.
you move on with that kind of aptitude and energy, then it's very likely that you're going to tick more boxes up than
Yeah.
blaming yourself and all that.
Yeah.
And and my suggestion is, obviously, read the question. Very,
Yeah.
very important is to make sure that all the information presented within that scenario, you've got
Yeah.
that. Read the task twice, because you don't want to miss the task, no matter how better your performance, how good your performance is. If you're missing the task, you're not examining the patient, you're not really comforting them in terms of showing the empathy, you're not going to pass the station.
Yeah. Yeah.
And as we teach framework in our courses, and there's something called squid approach, which you give the summary, invite them to ask question,
Yeah.
you offer them further information in terms of leaflet and fact sheets, and obviously give them a contingency advice, like danger signs, like these
Yeah.
are the signs, if this happened, come back. So tell
Yeah.
us your day of exam, and how did you go about it, and what works for you, and what would you like to say?
Okay, so when my exam started off, like every other person, I was extremely anxious that what would be my fate today, and I literally, my first station, I didn't even remember after my exam that what station it was. I was so much anxious in that station, but what I did was, like, I literally pretended as I'm not anxious at all. I literally took deep breaths. I read the tasks very carefully, because this is one thing that you do when you're very anxious. You tend to miss out on things. So I was literally going back to my tasks again and again, just to make sure that I'm signposting after every one of my tasks,
Mm.
and I am covering each and every point which is required by the station. So the when the station started off, I was literally stammering, but afterwards I was like, okay, just pretend as you're just talking to the other person. he is not an alien. He's just
Hmm.
another person, right?
Hmm.
So I just started talking to him, and it just felt like I'm sitting in my own country, and I'm just having a conversation with one of my patients. So it was like I felt very comfortable after, thinking that, okay, I'm just having a normal conversation. I'm not having an exam at the moment. The
That's
other
good.
thing, yeah, the other thing is like, when I was done with my history, I just, formulated all of the investigations that I'm gonna, tell the patient that, and how am I supposed to kind of, follow the 5 C's?
Yeah.
How am I supposed to follow the 4 R's? And literally, I was like, as fortunately, they were only kind of, able to see my face. This till here, I was literally, doing this. Okay, I'm done with 1C, second C, third C, fourth C, fifth C. Literally, I was doing that.
Hmm.
And with my 4 R's as well. The patient was very happy, and I was done with my first station. Then in the middle of second station, I just had a thought that, okay, I missed that one thing in my first station. I was like, okay, Farwad, whatever. You have to pass 10 stations only. Okay.
Hmm. Hmm.
So just focus on that. It's okay to kind of, fail one. So that really helped me in kind of, going through the next station.
Mhm.
And yeah, I think the main thing is like, you were right that you're supposed to take it as 16 different exams, and you're just supposed to forget about the previous station that you had.
Yep.
Yeah.
That's right. Dr. Maliha, what would you suggest? What would your suggestion be for the exam in terms of the day of the exam? How was your experience like, and what would you make an advice? What advice would you give?
Yeah, so my experience was really bad because I was in a different country, Pakistan. So my time zone was completely different. And the previous day I was done with my dad having a blood transfusion in the hospital. So it was like
Oh.
a very nightmare type of thing.
Hmm.
Just that's what I thought, because the last day, I think last 2 to 3 days studies doesn't matter. It's just like what's in your background knowledge and what a kind of experience you had. It's just that's what matters. In the last few days, just focus on the physical examinations and some, just like Dr. Farwa said, recent recalls and all those things. So on the day of the exam, just one, it's very normal to be anxious, and trust me, it will happen with everyone, of course. But just take it as a day in your ward or a day in your hospital. Just take it like that, and just like Dr. Farwa said, think that real patient is sitting. He's not acting. He's not role playing. He's a real patient, and he can be one of your father, one of your sisters, one of your cousins, or anyone in your family, or anyone you have seen in the hospital before. Just take it like that. And one station, it's just a matter of half an hour or 15 minutes through a station, and then you're done with your anxiety. You're not you won't I think it will happen with everyone. Once you're done with your first station, probably that's the max. After that, you're completely comfortable. You won't be having any more anxiety and all those things. I'm pretty sure about that, because you have knowledge. You have cracked one case, you feel confident, and just like Dr. Farwa said, they're not aliens, they will help you. So it's like a very you will get through it very comfortably, and just be confident and just take it as a normal day, and it's just like a day in a ward or in a hospital. So yeah, that's it. And just the more knowledge, or the more like just focus on your task, and the more confidence you have in your case, it will automatically relieves your anxiety. Okay, because you know the presenting complaint. Oh yes, I know the DDs. Yes, I know the DDs. I know the investigation. I know the management. Oh yes, in the 2 minutes you will have that confidence, and then in the next 7 minutes you will just, or 8 minutes, you will manifest it, and you will be all fine. So it's just an exam. It's not the end of
Yep.
the life. Just take it, because there are far more complex things in life. Yeah, so just take it as just a day of exam. Yeah.
I think that's
Yeah.
a very important point that both you and Dr. Farwa has made, is an
Yeah.
anxiety. And I agree. You need not to be completely oblivious to the anxiety. The right level of anxiety is your friend.
Yeah.
Overtly anxious, obviously is going to destroy everything. Under anxious, you're going to relax, you're going to be overconfident, you're going to underperform. But the right level anxiety just keeps you at your toes. The other thing which I completely can relate with my OSCE exams, no matter how many are done, station 1, station 2, station 3, you are in the rhythm of things. You don't even feel that you're in exam. And if you practice enough, and that's coming to same point that we are all talking about, Dr. Amitav, Maliha, and Farwa as well, that the more you practice, the more at home you feel, like you get absorbed with the patients, so much so that you feel like that you're talking with the real patients, and that whole thing of acting becomes natural. It becomes completely inherent, that you don't feel like that you're interacting with an actor. It feels like you're actually taking a history and examining a real patient. And that would just shows that everything is now going to flow smoothly from now onward. So having that, coming to coming to that second or third station, when the anxiety is just, it peaks, anxiety starts here and then sort of dwindles down, and then remain at the base level anxiety of, out of 10 being the most anxious, then maintain an anxiety level of 2 or 3. That is perhaps the way to go, and feeling natural is the ring. Now, Dr. Amitav, now some of the candidates, obviously there will be quite a few candidates who've taken this exam multiple times, and they feel more anxious because they've got more um, uh, more at stake. What would your take on be? And I think this is a very important topic that people often don't open about. And I would like to make a fact, make this that is natural. It's okay to not pass the exam. It's nobody expects you to be 100% at every front. So if you fail an exam at one time, my suggestion, because we deal with a lot of fellowship teaching in emergency, what I suggest to most of the candidates: look, if you failed an exam, don't worry, forget about this exam at least for the next time. Try to reflect on the critical appraisal and feedback based on the exam report. Also try to change your scenarios with the different tutors, with the different kind of study partners and groups, and prepare in a way which is a completely different new exam. So now you're taking a new exam based on the same knowledge, but as a new exam. So if you failed the first time, the second exam should be taken as a new exam. Give yourself the same amount of time, not like
Yep.
an abbreviated, like you're going to do 1 month and then take a next state. Give yourself time. You need to unlearn few things and relearn new things. What would your suggestion be? Because you've trained and worked with quite a few of these candidates who have not passed in the first go and then obviously have passed later onwards. What would you say in that area?
So it's really frustrating sometimes. Uh, so you have worked many years back home, and sometimes some Australian, like they're already working 3 years, 10 years in the Australian system, and even though they failed the exam. So I talked to them, like very recently. I asked one of them, like, I said, just it's all good. You prepare again. Then she said, yeah. So it's just a weird exam. So there's the answer. Weird exam means she works in hospital in NSW. So she failed the exam. So she said, like, I said, like that. This is the normal. We say that, really sorry. So best of luck for the next one. So she said, this is a weird exam. So yes, not weird means like this is a test of your knowledge and your communication skill and everything. So they are assessing multiple areas, like 4 or 5 or 6 areas in this exam. So that becomes a bit difficult. And those who are from the like the subcontinent, non-English speaking background, and from the different countries, so that's a bit like a bit difficult for them. But you can do that one. So if you fail again and again, or you failed once, that's all good. You take it easy. So make your time to prepare again and make your mind again like you're going to sit for the exam. And if you find your weakness, what is your weakness? If it is communication, is it your differential, or you're failing all the physical examination stations? So you sort it out and spend more time on that.
Yep.
And another one is, this is the exam of differentials. So they want you to differentiate one from two, or A from B, from C, from D, and how you are doing that one. They are assessing that one. Okay,
Yep.
so so that will be the good point, like not reading the feedbacks
Yep.
again and again, and that's how it works. Yeah.
Yeah.
That's it.
So you need to be more. So basically,
Yeah.
so you need to be a bit more economical. You need to find out what areas are weak
Yeah.
and emphasize that and stress
Yeah.
on those.
Emphasize on it. Yeah.
And the areas that you're comfortable, because I think the people who even fail, they are able to pass at least 6, 7, sometimes 8 stations. And I don't believe with the wording that there's something like as a borderline fail. If you fail, you fail. If you
Failure.
pass, you
Yes,
pass.
fail.
Exactly. So you don't
Pass. Yeah.
reassure yourself that, oh, I failed by one number or one station. It's not like that. If you failed, that means that your performance was way below the standard required to pass by most candidates.
Yeah. Yeah.
So you need to completely rethink the whole strategy, focus on the things that you have failed on, give them extra time, and try consolidate the things that you know very well, so that you're not, descaling from that point of view. Now, I'll ask if anybody of the participant, they can unmute themselves now, and if they've got any questions from any of us regarding this exam or regarding any of the things that we've talked about, you can ask the question now. Otherwise, we'll just call it a day. Has anybody got any questions or any points to
Yes,
make? Please go ahead. Who is that?
everyone.
Can you please, Tahira, Dr. Tahira, can you just please introduce yourself and ask your question? Thank you.
Yeah, my name is Dr. Tahira, and I have been like starting to prepare for AMC Clinical. Like I'm doing like on and off preparations. Actually, I completed my part one in 2018 and went back to my country back and did some recency and came back recently. So I just wanted to know that what if you, like all of you told about the study partner. So what if you don't get a good study partner? Like if you have been trying again and again, posting again and again that you want study partner, and you are talking to different people, but you are unable to find one.
I can help you with that kind of question. So when you're attending a course,
Yes.
make sure that the course has got role plays. So you should put your hand up in that role play. All right, we do role plays in our course are predominantly role play, and the feedback is based on that role play performance. Now you've got to understand that the theoretical part, obviously, it's time consuming, and you have to do that study in your own time. And when you're coming to the course, you role play as much as you can. Now, there's also a thing called active study. So this is one of the dilemmas that I had. I did not have any study partner to work with. All right. So I used to expose myself to as much role play as possible. Sometimes I could not have study partner because I was working a shift. I would have like one or two sessions with someone. Our faculty are also able to help with one-on-one sessions. So if you're not able to find a role play, then we can organize one-on-one sessions. Plus, we've also got what we call now a boot camp, which are entirely role play scenarios for 3 hours. So make sure that you are in that kind of space, that you are able to get to interact with the faculty in a role play scenario, not wasting your time with the courses who are just teaching, the cluster of shortness of breath. Remember, you've only got 7.5 to 8 minutes. You don't want to know each and everything about the shortness of breath cluster or nausea and vomiting cluster. You're not going to do that. You're not going to do that. It's hardly ever that AMC is expecting you to ask 18 different causes of headache. No, it's not like that. They're asking or expecting you to take a safe history from the headache point of view, and then give up a safe differential. That would be my advice, that expose yourself to more role play scenario courses, free sessions, boot camps. And one other thing which I did is, when I was doing physical examination preparation, I was practicing on my son. And he became so much in tune. He used to come to my room, study room, and say, Dad, you're not practicing on me today. Why? And so, it doesn't really matter if your partner is medically literate or not. Finally, yes, you're not getting that critical feedback and appraisal, but you can still practice. It's better than nothing. So have your family member that you can practice a physical examination. People even practice with uh, different prompts, and so don't feel that you're at huge disadvantage. There are plenty of resources out there, and you can certainly do that. What would you suggest, Dr. Maliha, if you haven't got role player? What would you suggest would be the suggestion on that?
Yeah, the same things, doctor. It's just I will click off that. Just try to, if you're doing any course, try to be as much interactive as you can. Always put up a hand, even if you don't have any idea about the case. Try to have an approach, because generally the approach is the same for almost every case. And plus, yeah, it's the same thing almost. And the other thing. was that just build your own concepts in this meantime, that like you can consolidate your own study, and meanwhile you can find, like, keep on finding like keep on searching, and then in the meantime you can like all the time study from different resources, and build your own concepts, and then try to, when you learn something from a course, then you can apply it in your study routine as well, that okay, I'm doing a case by myself, I have to think like this, I have to think of the differentials, I have to think of the management or diagnosis. And plus, because the main point is explaining the diagnosis, and mostly, trust me, the tasks are explain the diagnosis to the patient. So you can just say that you can practice it in layman terms by recording yourself, by doing a, like in front in a mirror. You can always say that, okay, if you have to explain ulcerative colitis, draw a diagram on your own, time yourself for 2 minutes, draw a diagram on a whiteboard. Okay, this you can record yourself, or you can of course feedback won't be there, but when you have attended a course, or you are attending a course, you know what are your flaws, and then you have an idea that you might, and then you can practice all the time, and you can use the layman terms and explain the diagnosis to your husband, to your or to yourself even, but always make a habit of making a diagram and time yourself, 1 minute, 1.5 minute, 2 minute. So I think this practice can also help you a lot.
Perfect. No, I think that's a very good. So, in summary, Dr. Tahira, I think it's a very good question. Lots of people are anxious, taking this to their heart that, oh, I have gone to study partner. I'm, at a huge disadvantage. But look, you can practice your own self. Most of it's explaining the diagnosis in a layman term. So you can have your family member, you can have anybody um, uh, in your friend circle who can you can help. Plus, having that passive approach. So even if when you're doing the course, you are able to try all those methods that you've done in your own private time to put yourself out there in a course, why the boot camps, why the course role play scenarios. And I think recording is a very, very good idea. When you record yourselves in time, it is just that reflection that you're your best critical appraiser, because you know that when you judge yourself, I think we're the best judge. We know, like, we are a bad singer or good singer or good performance. So that, I think that's a very good point. I remember I used to drive to Shell Harbour Hospital when I was preparing for my OSCE fellowship exam. In that 1 hour journey, I used to, just thinking wise, do at least 10 scenarios in my thought process only. That I'm just thinking about, okay, fine, I've got a patient with a chest pain. I need to take the history. I'm going to ask this, and that. I'm going to plan this exam, this investigation. So it would inherently prepare me. All right. So that's one thing. Now, somebody's asked a question, what about the boot camp? Look, all of the boot camp details are on website, emergencyfocus.net. If you go there and click the AMC, you'll have boot camps. Boot camps are normally at the end of our 6 weeks, 8 week course, 8 week course. It's just based on the high yield, high recall. So you can go and register for that. So next boot camp would be at the end of the next course session, which starts in July. So it would be in August sometime, or early September. Evening course, yes, we do have evening course, and our courses are 8 weeks, and you can find the details emergencyfocus.net. And yeah. So yes, iPhone 12 Pro Max. Please introduce yourself and ask your question. I'm sorry I couldn't attend you. Please go ahead. Yes, go ahead, please. You just mute yourself.
Yeah, do you hear me now?
I can hear you now, yes.
Yeah. Hi, my name is Mariam, and I'm preparing for my for the clinical exam as well. But I took my exam in in last year, the AMC Part 1, but my material is a little bit outdated for the theoretical. So my first question was like, how to find like an organized theoretical topics. So because like most of the what I find is like, all the topics are mixed together, question by question. There is a question in cardiology, then respiratory, then gynecology. So I'm a bit lost with that. So how to find something with like organized to just start to build my theoretical good. My second question is, during the I'm enrolled in a course, and during that we sometimes, like, when we discuss the management, people start talking about like the dosage, because some people already taking the exam are like had their like they were been working for years, so they know the dosage and everything. So at this level, do we need to know the exact dosages of the medications and that stuff?
Dr. Maliha, I think you would be the best person to answer this question.
Yeah, so for the
Thank you.
sorry, the dosages are not important in my view. I think just a little bit of the like morphine or very like life-saving type of drugs, or even then adrenaline, something like that. I'm really sorry. Just a minute, sir.
That's okay. So as I can take this question over, look, dosages are really not important.
Yeah.
This is not a requirement which would lead to a pass or fail if you know the dosage. Some of the common dosages like Panadol, ibuprofen, as Dr. Mali has said, morphine, if you know them, fine. It shows a practical, side of your approach, but they're not mandatory. In terms of your question, in terms of a theoretical approach or theoretical notes, as to say, look, my suggestion would be that look, I think you need to have some form of reading around a theory, and you would have your own theory. There's no such thing as having an outdated material. Theory, I think, is still relevant for chest pain scenarios. There's AMC books out there, the Handbook of Clinical Medicine, the things that you've studied, as Dr. Amitabh was saying, for your part one, they're still very relevant. I think where you would find that you need to shine is the practical, the speaking, the communication. I took this reverse approach when I was doing my MCs and PLABs and my even the fellowship exam. I would actually put myself out there, do the scenario, even if I don't know anything about the scenario. Like it's a completely new topic which I've never read before, and I would do the scenario, and then I'll go and read around that scenario from online resources, Google it, or from the textbook. I'll go and find that information in textbook. For AMC, the recommended textbooks is Murtha. But having to open Murtha and go through it from cover to cover, I think it's just not economical. It's a waste of time. But having to attend the scenario, making blunders and mistake, that's completely fine during the practice run. And then looking for that specific information in that Murtha or online resources or guidelines, that is much more economical. And if there's any other issue, then you can refer to your own notes. Dr. Amitabh, would you like to highlight?
Thank you so much. Thank you.
No, that's okay. Dr. Amitabh, would you like to say anything?
For the theoretical one, so they can get the course material. So you can get it from here. But even though you have to go here and there again, so unfortunately there is nothing then that can pile up everything here. So you have to go some like the guidelines, so Royal Children's Hospital guidelines and the STI guidelines and some basic books. So here in the study materials, you will get lots of theory there. So like the pre-reading, that's where you get the all the academic, like the ingredients.
Yeah. So basically what Dr. Amitabh is saying, that we've got a portal in which every topic which is asked in exam. In fact, I've got a feedback from of the participant, Rebecca, who's just passed the exam, actually. Dr. Amitabh, she says thank you. So basically she passed the exam in February, and she was saying that all of the scenarios that we were doing, and they prepared her for the exam. And she found the portal, all the information in the portal very valuable. So yeah, so the portal are the kind of questions which are focused around the exam, as opposed to dilute the information going into the depth of theory, which you really don't need. Anybody else has got a question, or they've got two participants? Yes, please go ahead, introduce and ask the question.
My name is Dr. Mariam, and I recently came to know that AMC is going back to face-to-face exams full time. There won't be any online exams after September. So my question is, how do we prepare the physical examination from that point of view, and with only the online course that we take, and how do we prepare ourselves for the physical examination?
All right, look, I can reflect some, and then I'll ask Dr. Farwa or Dr. Amitabh to reflect on that. Look, there's a very little difference between when it comes to the physical exam in the online version versus the real physical exam version. There's some certain tweak which is required. In terms of preparation for the physical examination, you need to go through the theoretical aspect of the physical examination, and plenty of resources are out there. They're in Geeky Meds, there are YouTube videos, they're actually on, videos from AMC point of view, which people have put out there in terms of the motions of doing the cardiovascular exam, in terms of motion of examining the ankle, the knee, the hip, whatever it is that the scenario involves. So make sure that you orient yourself first and the foremost with that available resource on, which is freely available on the YouTube. But make sure that your selection is quite optimal. Like you're not settling in for the substandard variety. So Geeky Medics is one of the better ones, and there's some other MRCP paces clinical examination videos which are available. So make sure that you have got a good and abundant resource, which is reliable resource from the exam point of view. Number one. So that comes the theoretical aspect of preparation or getting yourself to know the motion of the physical examination. The other thing I'd like to say and emphasize that I've actually incorporated the links of those crucial videos in our course on our portal. Make sure that the examination videos are not more than 7 to 8 minutes. If you're watching a detailed cardiovascular examination which carries on for 20 minutes, trust me, it is not helping you. The actual exam is 7.5 minutes of physical examination station. 20 minutes of cardiovascular, respiratory, or neurologic examination or cranial nerve examination is not going to help you. All right. So make sure whatever resource you're picking, they are tuned in from the AMC clinical perspective. The other thing I said that if you need, once you've learned that resource and read around it, practice on your own family members that, look, I need to examine the cardiovascular examination. I remember that I became so sleek, Dr. Amitabh, in my cranial nerve examination on my son that I used to finish them in less than 4 minutes. So that is something that else you can do. If you've got a face-to-face examination, which are going to be available more, then practice on your family member. Okay, you don't have to have pathological findings. In fact, AMC would not have the resources to put the patient with pathological findings in terms of facial nerve palsy or anything like that. They might be, but they might not be.
They give the picture of the
exactly
Bell's palsy. They pick the picture.
Exactly.
And some patient, they bring the real patient, like the diabetic foot and ITP. They bring the real patient, and sometimes they mimic like the foot drop. So if anyone asks that, like, the don't lift up this foot and do the high stepping gait, so it becomes foot drop.
Yeah, so that's very rudimentary what they're actually trying
Yes.
to put in terms of pictures and in terms of foot drop, and that's something which you can. So basically, they're trying to see your mannerism in terms of approach to the patient, in terms of your introduction, consent, washing hands. That's crucial, and that you can prepare and replicate anywhere, practicing at home kind of scenario. And as Dr. Amitabh said, that you should be able to pick the pathology from the pictures, from the patient's complaint of foot drop, which they're mimicking, and build your examination on that. Any other questions? Anybody got a question? Dr. Mehvish, I've got a question. Mehvish M, you can ask the question, please.
Yes. Hi, Dr. Rizwan. This is Mavish, and I've booked my exam in September. And luckily, I got a chance to go take a course with you, clinical course. I took the boot camp as well. In fact, I just finished just day before yesterday. Oh. And yes, it was the best thing I did for myself, and it gave me a lot of confidence. Initially, put me in the hot waters, but I'm sure that at the end of the course, me and my fellow participants, we all were able to make it, and we all were very confident to just do it on ourselves. So thank you very much, Dr. Rizwan, to give us this opportunity. Also, my question is for the participants and the faculty who passed the exam, the importance of recall. So everyone says they do the recent recalls, especially. So I'm just asking anyone if you can answer, please, how far in the recalls we can go? Someone says 6 months, someone says do 1 year of the recalls. So what is your suggestion in terms of your experience?
That is a very good question. In fact, thank you, Dr. Mavish. Thank you for appreciating our role play course and all the practical tips that you've had. In terms specifically for the recalls, don't be completely reliant on a recall. You've got to remember the recall based on candidates' information in a very anxious environment. They might not be reproducing the 100% accurate information. So trying to come to a judgment based on that recall and then failing miserably would be the huge disservice to yourself. So don't rely on recalls. Make sure that, yes, look, recalls might be there. Make sure that you expose that yourself to that differential. So it might be a recall about like comes in with the Down syndrome counseling about a patient, or there might be a recall around like, ulcerative colitis counseling, but it might be changed to Crohn's disease. It might be something with the global development delay in terms of Down syndrome. So make sure that you take recall with a pinch of salt, but include that this is the flavor which is circulating this time in the last 6 to 12 months, as opposed to completely following each and every intricacy of that recall, because that recall might be completely flipped into a different topic and scenario. That would be my suggestion. I'll get Dr. Maliha to comment on that because she's obviously sat the exams recently. What do you feel in terms of recalls, Dr. Maliha?
Yeah, so the same thing which you said, it's more on focusing on the differential. Don't just grab them word by word because they can change the scenario. I think the approach can be at least to be very specific, like 4 months or six months even. I think it's more than enough, and just write down the new topics which are coming, because the new topics sometimes they're pilot and then sometimes they can get scored as well. So always get the new topics or a new presentation. Or like for example, in the previous year when I was doing, there was a case of a PV bleeding, simple PV bleeding, but that was misplaced myelina. Heavy bleeding with myelina is very less likely. So what was the point? Okay, it was a misplaced myelina. Oh yes, it's a new thing because PV bleeding differential or cluster does not usually come with PV missed myelina. So it was a new case. So I'm just giving you an example in a way that how you have to, don't waste your time much on the recalls, just like you can pick the new cases or pick the new diagnosis which is coming in the last 3 or 4 months, because it can repeat. Like then you can have an idea, okay, yes, this can also come with the PV bleeding, just like that. And one thing with the, I just want to add with the physical examination. Sorry, I just want to add one thing, that please don't leave the physical examination practice to the end week or 2 weeks. Try to practice every week, 1 day or 2 days with your husband, partner, anyone on the weekends, because if you will practice it frequently, physical examination, like for 3 to 4 months, it will become your reflex, and then you can do it very quickly. So that was for the physical examination, just like that. And for the recalls, I think 3 to 4 months, I just pick the new cases. I just that's more with it, I think.
That's a
Don't waste
brilliant tip.
much time.
That's a brilliant tip. Actually, practice and keep on practicing, because it should be at your reflex level to be able to finish in that 6.5, 7 minutes. The other question that I've got asked, that when is the next boot camp and what are the charges? The next boot camp would be in September, I think, or the end of August, most likely end of August and 1st of September. I'll have a look at the dates, and they will be announced on our website, www.emergencyfocus.net/AMC. So please have a look at that. The charges, I think, for our boot camp is 5 days. It's based on high yield topics and scenarios, and we tend to change the scenarios and topics based on the current sort of flavors as to, or themes as to, and we do like 8 to 10 role plays for the 5 days. So you're looking at 40 to 50 role plays in that 5 days of boot camp. Any other questions anybody's got? Dr. Mavish, I've got your hand raised. Maybe you've already asked the question. Is there any other question by anyone? I think that's about it, really.
Hello, doctors.
Okay. Hello.
Hello.
Who's that? Yes, you can ask your question.
Good evening.
Good evening.
Doctor, I'm Smotara. I'm now planning for the AMC Clinical actually.
Mm-hmm.
So I have 2 questions to you all. What is the proper way to do an effective role play with a player? And what is the technique I should follow to manage the time actually?
Okay. Dr. Amitabh, would you like to explain that? What is the best way of interacting with the role play and how to manage time efficiently?
Yeah, so the role play, like whenever you see the stem, so ideally you should take any random case from the handbook. So so you pick up the history of present illness. Okay, so history of present illness, for example, it is dizziness. So then you think of your differential for the dizziness. Again, it should be age specific differential. Okay, sex specific differentials. So it will be very close differentials, and it will based on the symptom. For example, dizziness for 3 months, dizziness for 3 days. So it's different. Okay, so sometimes you can mix up. Then you explore this dizziness first. So history of present illness. So that one you explore that one. Then you go to the different differentials, and in between you ask the associated symptom, and you ask the red flags, risk factors, and some other mnemonic you will be applying like setma or something. So you think of those ones. So that is the one approach. So it will change, but basically this is the same thing.
Yeah,
And
and the
about the,
sorry, go on,
yes,
Dr. Mito.
second one is the timing. So if you keep on practicing with your study partner role playing, so that will be enough. So you'll be at the end of 2 months or 1 month, you'll be finishing all the case within 7.5 minutes. It's very unlikely that you will go beyond the 8 minute or 10 minutes. If you are going there, like if you cannot finish within 7.5 minutes, you think of like, what are the unnecessary questions you have asked in the history? What you can delete from the history? So you can think of it, and you speed up also your like the speaking and the communication skill. That time you can, like, you're thinking and asking that kills your time. That you can also improve.
Yeah, and I'd just like to make a further comment extending Dr. Amitabh's points, is that when we are doing our course, we've got an approach in terms of wave work, which is 2-minute outside thinking approach, 7 minutes inside planning in terms of introduction, communication, laying out the plan. Like, my name is so-and-so, I'm going to take I'm going to take history by asking you a question. I'm going to examine you by doing this thing. Is that all right with you? Are you in the current level of analgesia? And then summarizing what you've done and asking any question at the end if you've missed anything from the actor, and then, you know, danger signs. And we tend to tweak it towards the end days to 7 minutes. So basically you're even feeling more time pressured. So that minute at the end becomes a luxury. And that's, I think, so important. That's which I'm trying to highlight, is that when you are doing role plays, you are actually completely exposing yourself to a new way of learning. It's a completely immersive, interactive learning. And the time strategy is built into that. It's not something that you can plan separately. It's built into that. The more comfortable, confident, and sleek you get, your timings become more economical. All right. So this is something that you need to realize. The more practice you do, your timing automatically improves. All right.
Right. Yeah.
All right. Any other question I'll see is, should someone go to 8-week course? If not, a beginner or a boot camp will be our choice. I think you must always start with the 8-week course because the course is based on the whole variety of topics across the breadth of topics which get asked commonly in AMC, and all our courses come with the boot camp automatically. So do that. Okay. Don't disadvantage yourself. You've only got one crack at this exam, which is the first crack, which should be with the best of your abilities. You don't want to keep on doing it over and over again. All right. Thank you very much, guys. Unless and until if there's any other question, thanks for taking the time. Study hard, relax, make sure that you are nice to your family members. And thank you, Dr. Farwa, Dr. Amitav, Dr. Maliha, for taking time and coming in here and sharing your valuable tips and tricks. And those who want to register for our course, you can jump on the website emergencyfocus.net/AMC. Our portal, which comes with the video recordings of all our previous courses plus the notes. So it's really one source where everything is built in, so you're not really wasting time here and there. And if our faculty are always there to help you if you need any further tips. And most of the participants really are able to find their study partners during that session. One last thing I'd like to emphasize, which I think it's my duty to educate every participant, is please don't waste time in theoretical courses. They are not really helping you. If you want to learn theory, please do that as a pre-reading in your own time. That is much more economical and interactive and proactive way of learning. When you come to the course, put yourself out there. I've prepared this. Let's test it. So the exam, when it comes to the exam time, it's almost natural for you. All right. Dr. Taira, I'll take one last question. I think you've got something to say.
Yes, I'm so sorry I have to ask this. Actually, like, I don't know, it's just me or it happens to somebody else. Like, what to do if you feel like you are stuck? Because like doing some courses, you realize that you should do, before the course, you should have your own knowledge. You should study like some basics and everything. But then if you are going through the JM or something like that, and you feel like you are again wasting your time because you don't need to do that cover to cover, like how to do that approach? Because if I know, like for the people who have just given the part one, it's quite easy to prepare for the part two. But if there's a gap, and you have like you feel like your knowledge is like not that much retained now, so like how to move forward? Like I myself
That's a
feel
good
like,
question. So
yeah.
basically what you need to do is come to the course and do the role play. And I would encourage you to fail miserably in that role play. That will completely expose your flanks to the deficiencies you've got. Because look, there's a perceived deficiency and there's an actual deficiency. You may think that you've forgotten something, but unless and until you practice that, you would not know what you've forgotten. So when you practice a role play, you would know that you're able to remember things which you would otherwise not know. You can blindly cover to cover read books. You can go through these PowerPoint courses that they are being offered over and over again, going through the cluster of shortness of breath, the cluster of chest pain, and you will hear from this side and it'll come out from that side. So because you've passed part one, you've done the hard yards. Now it's time to put that into practice. And that practice is actually putting yourself into a hot seat. Once you know that this is the deficiency, this is the area which I'm completely not versed with, then you can open JM, John Murtha, or any other resource that you've prepared from and focus on that and learn that. Plus, you'll get a feedback. So when we do role plays, we do 10-minute role play and then we'll do 10-minute feedback. We'll give you a direct feedback. We'll impart that knowledge. Look, this is deficient. This is how it's done. This is how you take a chest pain history. So that critical feedback and appraisal that we were talking about, Dr. Maliha was talking about, Dr. Bharwa was talking about, is basically that you get that in a very focused way, in a very short way. You take that verbally, you take that and then you read around that topic. So that is my suggestion. Obviously it's not a holy grail. It's not something that may work for you, but that's how I passed all my exam. I had a busy family life. I was working full time. And I think I always emphasize that you need to be smart, and that smart strategies actually come from how I've seen these local white people when they come to preparing the exam. They would do sports, they would participate in competitions and surfing and all that and pass the exam in the first attempt. It's because they're efficient with their time management. They would put themselves out there to the topics which are exam savvy. They will practice and keep on practicing and then focus on the areas which they're deficient. And by the time the exams, they're ready. So that would be my suggestion. Thank you very much, guys. I think it's coming to nearly 1.5, 45 minutes. And thank you, Dr. Maliha. Thank you, Dr. Amitabh.
I just had one thing
Thank
to
you.
add, Dr. Rizwan.
Yep.
Just one thing to add. It's my experience, my own experience, my suggestion. Please don't take it like for everyone.
Yep.
I would suggest that please don't start with the handbook. Just if you have a very long, I'm really sorry if somebody doesn't agree with me. It's just my own opinion because because you have a gap. So I think starting with the handbook, it doesn't make sense in the start. When you start doing the cases, just like Dr. Rizwan said, with the role plays, then after some study, when you start doing the handbook, then it makes more sense.
I completely agree. Completely agree.
Yeah.
I think
Handbook
it's
is a bit difficult book actually.
because you don't know. You're just trying to gain all that information, which is built on theory up until, and you've only got 7.5 minutes. And handbook may have an information which is worthy of 20 minutes. So no, I completely agree with you, Dr. Maliha. I think it's a very good point. Thank you for that. All right, guys. Thank you very much. Thank you, Dr. Amitabh and Maliha. Again.
Thank you.
Have a good time with families.
Our pleasure, sir. Thank you so much.
Thank you. And take care, guys. And we'll see you at one of our courses or come say hi. Thank you. Bye-bye.